How long does it take for Florastor to work? If you are curious about how long it takes for Florastor to start working, you are not alone. Many people with sensitive stomachs, including those dealing with irritable bowel syndrome and colitis, want to know when they can expect relief. Florastor is a yeast-based probiotic supplement that contains Saccharomyces boulardii, which is known for supporting digestive health. When you take Florastor, the capsule dissolves in your stomach roughly 30 minutes after you swallow it. This process releases the yeast cells, which then begin to act in your intestines. It is important to note that Florastor does not permanently stay in your gut. Instead, it works only while you are taking it and is naturally eliminated from your system within about 5 days after you stop using it. The time it takes to notice benefits can differ based on the digestive issue you are addressing. For acute problems like antibiotic-associated diarrhea or infectious diarrhea, you might see improvements within a few days to 1 week. However, if you are managing chronic conditions like irritable bowel syndrome or colitis, you may need to be patient. Relief from symptoms typically takes longer, often between 4 to 12 weeks of consistent daily use. This timeframe aligns with general findings on probiotics, where gastrointestinal improvements usually take a few weeks to appear. If you have a sensitive stomach or inflammatory bowel conditions, it is best to start taking Florastor gradually and keep an eye on how your body responds. Some mild side effects, such as gas, constipation, or thirst, may occur in less than 1% of users. Rarely, allergic reactions or other adverse effects can happen, so it is wise to consult a healthcare provider before starting, especially if you have existing gastrointestinal issues. For those managing irritable bowel syndrome or colitis, taking Florastor daily and allowing at least 3 to 4 weeks can help you determine if it is beneficial for you. Continuing use for up to 12 weeks may lead to more noticeable improvements in symptoms like bloating, irregular bowel movements, and discomfort related to inflammation. Since Florastor is yeast-based, it remains effective even when you are taking antibiotics, which is an advantage over bacterial probiotics that antibiotics can destroy. In short, while Florastor may begin to work within a few days for acute digestive issues, it generally requires several weeks of daily use, often 4 to 12 weeks, to show meaningful benefits for sensitive stomach conditions like irritable bowel syndrome and colitis. Consistent use and medical guidance are essential for safely incorporating Florastor into your digestive health routine.